Well, welcome back, everybody, to Thrive in Your Body with Homeopathy series of interviews where we discuss what homeopathy can do for you and your loved ones, especially if you're suffering from any kind of chronic health condition. So, welcome back, and I am very, very excited and honored to introduce you to our wonderful guest today. I'm looking forward to learning from her. So, let me introduce you to Lisa Decandia. She's an expert on women's health, and we will address a very important topic for many women today, which is menopause, and also how to treat menopause homeopathically with homeopathy, right? You may not know about that, so I'm excited to bring this information to you today. So before we get started, let me introduce you Lisa DeCandia, and I'm going to read her brief bio for you first, so you know who she is. So Lisa Decandia has been practicing homeopathy for over 23 years. She currently practices in Newmarket, Canada, where she treats a variety of health issues, including the treatment of children and women's health issues. Lisa is the core lecturer at the Canadian College of Homeopathic Medicine in Toronto, Canada, where she teaches a range of homeopathic studies. Homeopathy is a passion for Lisa, and it brings great joy to engage homeopathic students with studying the repertory, taking philosophy, or analyzing a variety of homeopathic cases. Lisa is also an international speaker and has spoken at the National Center for Homeopathy joint conferences and a variety of seminars within the homeopathic community. Lisa has received her master's degree in science homeopathy with distinction from the University of Central Lancashire in Preston, United Kingdom. She is also a registered bioenergetics intolerance elimination practitioner, and she has a special interest in working with food and environmental allergies using this technique. Well, then without much further ado, let me bring Lisa Decandia to the screen. Welcome. Thank you so much for joining us today. It's such a pleasure and honor to have you.
Oh, it's my pleasure, Monica. Thank you for the invite.
Absolutely. So we're going to talk about menopause today. But first of all, I would very interested if you could tell us a bit about how you found homeopathy. So what led you to focus on homeopathy in your treatments, and why did you choose to focus on women's health?
So I guess in some ways you can say homeopathy found me. Um, and I think, Monica, from speaking to lots of other students and homeopaths, it's personal experience that has led us to discover homeopathy. And so the same occurred for me many years ago through a variety of health issues. I went through the conventional route. Then I was guided to a naturopath who continued to help me in my journey. But this naturopath also said, I think that you would really like homeopathy. And so I started to explore that. I also had my daughter at around that time. She was 1 then, and now she's 33. Um, and when she started to have a lot of ear infections as a child, it happens. And I was told antibiotics, antibiotics, possible surgery. And when I heard the word surgery, I went, no, there's got to be something else. And so I took her to my homeopath, and literally with one dose of a homeopathic medicine called pulsatilla, there have been no issues. I'm knocking wood here. There have been no issues with her ears, with her ear infections. And this just caught my attention. And I said, I have to study this. I have to do it. It's like a calling. And so over 24 years ago, I enrolled at the Canadian College of Homeopathic Medicine. Went through the program there and started practicing. I think that for me, why women and children, it's just sort of what evolved. You know, women would come and see me. We would do some treatment. Then they would want to bring their children. I now treat some children that I treated when they were in utero 25 years ago. So I have this wonderful opportunity to be with the family for many many years, and so that's kind of my story.
What a beautiful story, and what a beautiful continuity in your career, seeing the same people as they grow through stages. And I bet you are living a very healthy life with homeopathy.
They are, they really really are, and that's the thing. I know we're going to talk about homeopathy in depth, but one of the things that I've really seen in practice, and because I'm blessed to be able to practice with families for so many years, is that literally their immune systems over time with homeopathic treatment have so strengthened and they are less sick.
Yes, beautiful. Wonderful. So, we're going to talk about women's health and in particular menopause today.
Mhm.
So, let's jump over to that topic. And could you tell us about menopause in general? What are the signs and symptoms? And especially, it's very interesting. Some women would get more menopausal treatments, or I'm sorry, symptoms than others. So let's discuss the symptoms and signs of menopause first.
Okay. So there are many, but you could put them in three categories, let's say. Vasomotor, I'll explain these: vasomotor, genital, and psychological. So vasomotor occurs when, the nervous mechanism or the nervous system that controls the closing and the opening of blood vessels isn't working that well for whatever reason. Okay. And so the consequence of that is the symptom of hot flashes, which is really the big symptom for many women. It actually, I was looking it up, 50 to 90% of women have hot flashes during menopause. So it's a big symptom in menopause. And for some women, it could be very mild. Some, it could be very intense. For some women, it could just occur on the face. For some, whole body. For some, just on the chest. It could be with or without perspiration. Um, so that I'm going to say that that symptom in itself will bring women in for treatment. Other vasomotor symptoms could be heart palpitations or even something called formication, which is like itchy, crawly skin without any eruptions. Other associated symptoms with vasomotor are fatigue, dizziness, headaches, and insomnia. So that's one category. The next category is genital symptoms. And this relates to what's called the loss of tone and elasticity of tissues that predominantly affects the uterus, the vagina, and this can result in dryness, which may affect sexual activity. And then these thin vaginal walls can make a woman more predisposed to like yeast infections or persistent itching. The loss of tone can also affect the bladder and can also affect the urethra. So there's an increase in urination. Some women come in and go, I've never had this problem before. Now I like have to go to the bathroom every hour. And that's the loss of tone. If there's loss of tone in the bladder, this can predispose a woman to what's called stress incontinence. So if she coughs or sneezes, there could be some leakage of urine. Now, the decrease in elasticity of the tissues also can just affect the skin and result in loss of tone of the skin and also dryness of the skin. Psychological factors, which we call in homeopathy mental emotional symptoms, could be anxiety, panic attacks, depression, anger, irritability, loss of motivation. You know, she just doesn't feel like doing what she used to do. And this can lead to fatigue, sleep problems. Few other symptoms that I have noticed in practice: fluid retention, weight gain, certain food cravings, osteoporosis. And if a woman has like a chronic condition like arthritis, it can actually worsen during menopause. So those are kind of, you know, the symptoms, if you will. Right? And I'm just trying to recall. It was a two-part question, and I think I answered that.
Yes, yeah. Well, this is great. So in terms of the second part of the question is that there's so many symptoms and they vary from person to person, but then some women would not experience as many, or maybe wouldn't even experience any symptoms, whereas some are really going through a very hard time during the peri and menopause period. So why does it happen?
Well, I wish I had a crystal ball to tell you with each patient. But there are, I guess, through my experience, I'm going to talk about looking at the four corners. So if you imagine the four corners of a square or the four corners of a room, this might give an indication as to why some women have it and some women have minimal. And so in corner number one, take a look at your genetic line. Take a look at your mother, your grandmother, your auntie, your cousins, sister. Do they have menopausal symptoms? What are their menopausal symptoms? What's the severity of their menopausal symptoms? And so this may indicate what is in store for you. Okay. When I've asked my patients, because I do ask, I'll say, did your mother have, menopausal symptoms? And for the most part, women can track back to somebody. They're like, oh, yeah, she so suffered from hot flashes. It was awful. Now, some women, genetics doesn't play a part. Okay, so corner number one, check your genetic line. Corner number two, nutritional and environmental factors. And I know we're going to talk more about this, but just to say, check in, what kind of diet are you eating? Predominantly, is your diet what is called a white diet, meaning white flour, white sugar, white rice? Because if someone is eating those kinds of foods, let's say on a consistent basis, this may create what's called inflammation in the body, which can lead to symptoms, especially symptoms of hot flashes. And to, build a little example, if you will allow me, let's pretend that we're kind of building a campfire, okay? So we'll start with high levels of estrogens, and I'll talk about where they come from in a minute. High levels of estrogens, which is like the kindling or the little sticks of the fire. And then we have toxins in the environment, pesticides, chemtrails, and this is like lighter fluid on the fire. And then we have stress hormones, which really can affect women, cortisol, adrenaline. And then if we add sugars, especially processed sugars, that's the match. And boom, you have a hot flash. So I do think, nutrition is really something that we look at to keep women in balance. And then, of course, there's our environment. And I would say, I don't know, Monica, if you have seen this in your travels, but you know, our world is becoming more toxic. And there are many estrogens, extra estrogens, like phytoestrogens, xenoestrogens circulating in the environment, in plastics, in foods. And this all contributes to an increase of estrogens that circulate in the body that sometimes we can't eliminate from our cells. I mean, this is one of the reasons why very young girls, like I'm talking 6 or 7 years old, are already in puberty. Yeah. Corner number 3. Let's take a look at our lifestyle. So this is beyond nutrition. Do we have balance in our life? Do we have enough balance between work, play, family, friends? Many women in the perimenopause, menopause age are in what I call, and not only me, call the sandwich generation. So they're taking care of children and they're taking care of elderly parents. This puts a lot of stress on that woman. Stress creates this energy that gets into the cells, and the hormones start to circulate. The cells cannot release all of this hormonal activity, um, and then we have uncomfortable symptoms. Let's not forget exercise. That's part of lifestyle. That really, really can help detox, if you will, extra hormones and things that we don't need circulating in the body. Corner number 4 is our mental emotional state. What I mean by this is take a look at, are you still struggling, let's say, with an unresolved guilt, um, an unresolved hurt? Has there been anger, irritability that you just can't let go of? And if you can say yes, I think that has a huge impact on it. I have this book, it's a very old copy called Women's Bodies, Women's Wisdom. It's by Christiane Northrup. Hang on, that's the way to hold it. And if you indulge me, I just want to read a quote. She talks about menopause. And she says, women in midlife are at a turning point. Either we can continue to live with relationships, jobs, and situations that we have outgrown, a choice that hastens the aging process and the chance for disease dramatically. Or we can do the developmental work that our bodies and our hormone levels are calling out for. When we do this, we truly prepare for the springtime of the second half of our lives.
Beautiful. Yes.
So those are the 4 corners that I will look at and have women look at. And, because homeopathy is such a holistic form of medicine, it covers all of those corners. Yeah.
Yes, yes, beautiful. Well, that leads us to our next question is then how is homeopathy actually helping all those symptoms? And, how can it help restore the hormonal balance, if at all?
Okay. So you speak about balance, and it does go back to balance. Somehow over time we get out of balance, and homeopathy helps put us, let's say, back in balance and allow us to self-heal. Okay, that's the goal of the homeopathic medicine, is to really promote self-healing. So one of the principles of homeopathy rests on the law of similars, or like cures like. And a homeopath will record the symptoms of a patient, let's say the symptoms of menopause, the symptoms of hot flashes, and we'll find a homeopathic medicine that will mirror those symptoms that the patient is experiencing. Then the homeopathic medicine is given, and it's like a key to unlock a door. And then the self-healing can begin. Homeopathy allows the energetic signature of a substance in the form of a homeopathic medicine to match a similar pattern in the body or the organism. It then helps to release that pattern or those symptoms, helping the person return to health.
Hmm. Beautiful. And it's all based on purely knowing the symptoms and interviewing the patient, right?
Absolutely.
Mhm.
Absolutely. The symptoms are what guide us. Okay. It's the body's expression of saying, hey, hello, there's something not right here. I'm dealing with some stress, so I'm going to show you some symptoms. Okay.
Mhm.
And homeopathy works with the symptoms, not against them. You know, in conventional medicine, which, sometimes is necessary in life, you will find words though like antidepressant, anti-anxiety, right? Antihistamine. It, just by that word, these medicines look to stop and suppress the symptoms. Whereas homeopathy looks at and works with the symptoms to find a suitable homeopathic medicine for that individual.
Beautiful. So you mentioned conventional medicine sometimes may be necessary, but we already see there is a huge gap and difference. Can you elaborate more about on the difference between the homeopathic treatment and the conventional medical approach?
Well, again, going back to what I said about, it's a difference in philosophy. Okay. Conventional medicine is, let's fight the symptoms. Let's use our anti this, anti that, fight them, stop them, suppress them. Homeopathy looks to, first says, okay, what are the symptoms? What are they trying to tell the patient? What homeopathic medicine is most similar to those symptoms? And how can we fix the situation as opposed to fight? Let's fix the situation by helping the body heal itself.
Okay, beautiful. So my other question was really, what can we expect during the homeopathic treatment? And maybe you can give us some examples as well, if possible.
Sure, absolutely. So in, let's say, an initial homeopathic consult, be prepared, at least with me, be prepared to sit with me for about an hour and a half, which that in itself blows people away because, why would I want to spend so much time talking to you? Well, I want to know the symptoms, physical, mental, emotional. I want to know the history. I want to know how you got here. I want to know what is special and unique about you, because all of this, when I pool it together, helps me find the best homeopathic medicine for you at that time. And so there's lots of questions. I even have patients, let's say they come in with menopause symptoms, and I start to talk to them about food cravings. And they're like, yeah, what are your favorite foods? And they'll be like, why does that matter? Well, it matters in the whole picture of who you are. Or I ask them, what position do you like to sleep in? Why do you care, Lisa? Well, because again, that fits into the whole picture. So lots of questions, definitely in the first consult, but also in the follow-up. Um, Lots of time spent together and lots of guidance. lots of guidance at each follow-up in between, because this is a journey. I like to say to my patients, I'm walking with you now in this journey of health. I'm like right beside you.
Yes, beautiful. It's so much more personalized, right, than conventional medicine. And but then, well, can you tell us a little bit more about what actually medicines, how homeopathic medicines help, and any examples of medicines that may help? And of course, we do not advise anybody to try it on their own because we need a professional homeopath. But just out of curiosity, if you can mention some of them.
Sure. Um, I'll mention two in relation to hot flashes, just so that hopefully you can see and everyone can see um, the importance of symptoms. So there are the two homeopathic medicines for hot flashes, and I use many, but these two, one is called Sepia officinalis, and the other one is called sulfur. So sepia comes from the cuttlefish, and sulfur is a mineral, sulfur. So here are a few symptoms of sepia. Now, this is not to say the person has to have all of these symptoms, but if they have some of these, then sepia may be the homeopathic medicine to help them. So hot flashes in sepia are followed by drenching sweats that move up the body. And in fact, the heat of sepia can start, let's say, somewhere in the abdomen and move upwards. Okay. Whereas other remedies, the heat moves downwards, but with sepia, it extends up the body. For sepia, hot flashes followed by exhaustion. She's just exhausted by the hot flash. And then something called anxious hot flashes, which I learned years ago actually from a patient. She says, I get these anxious hot flashes. I'm like, what does that mean? And she said, oh, I feel literally anxious here in my chest. And when I feel anxious, then I know the heat is coming. And sure enough, she'd get this like little feeling of anxiety and then break out in a hot flash. For sepia, hot flashes, sweating, and weakness. If you've got those three symptoms, those are good sepia symptoms. There can be, on the mental emotional level, there can be lots of irritability, loss of motivation, huge loss of sex drive, and yeast infections. So that's a sepia picture. Okay. Again, there's many other symptoms of sepia, but in a snapshot. Now, sulfur. Sulfur has hot flashes, but the hot flashes are burning. Okay. The patient says burning heat, especially in the top of the head, the vertex. Burning heat of the hands and the feet. So much burning that at night, patient has to stick their feet out from the covers. I've seen sulfur, people who need the homeopathic medicine sulfur with their hot flashes, sometimes no perspiration, sometimes a little perspiration. It's the burning quality that's key. Lots of dryness through the body and a few mental, emotional. The memory, they start to, like, they can't find the word or they can't remember something. Very itchy scalp and a huge thirst. So that gives you an idea of, how they are different. They both can treat hot flashes, but they are different in their symptoms.
Yes, and I bet you those two women, a sulfur patient and a sepia patient, if they went to a conventional doctor, they would get the same medicine, right?
Absolutely.
Uh,
Absolutely.
but that leads me to ask you: are there actually situations where some of the women would be advised to get hormonal treatment to actually see a regular conventional doctor?
And, Monica, I find this to be a personal choice. You know, I'm there to support someone, whether they get conventional treatment or not. You know, sometimes when there is what they call artificial menopause, so for example, if someone has had to, for whatever reason, have a hysterectomy, it literally throws them into the symptoms of menopause. They might be a candidate for hormone replacement therapy because it's too sudden and too quick, the onset. But I've had patients who have had hysterectomies and are on HRTs, and they will come to homeopathy and we treat the symptoms. And then, with discussion with their doctor, many of them can get off HRT because homeopathy is helping them with their symptoms. Other examples, someone may want to seek conventional treatment you know, if they're really suffering from polycystic ovarian syndrome or diabetes, which then exacerbates the symptoms of menopause. Getting hormones tested, you know, through conventional means can always give us more information. Um, so again, I will speak to a patient about it, but at the end of the day, it really is their choice.
Yes, and I think you mentioned something important, that it doesn't hurt to have as much information as we can. And knowing your hormonal balance, your picture of where your hormones are actually at, will help your homeopath to understand what may be going on as well, and find perhaps better remedy. Yeah, and is it possible for you to give us maybe an example or two of patients who were helped?
Yes, off the top of my head, yes. um, actually have a patient who I gave the homeopathic medicine sepia to. Um, and she is a mother of 3 children, and young children. But now she's moved into perimenopause. Perimenopause can start as early as 35, um, which astounds many people, but it can. And so for her, her symptoms started fairly early on. And her big symptom actually was insomnia. And she just chalked it off to, well, I have 3 young children. I've had lots of sleepless nights. Of course, you know, my sleep is not going to be good. I mean, this created a lot of fatigue to the point where she could not actually do everything that she needed to do at home. Prior to having children, she was on the birth control pill for about 10 years. And, you know, again, people do what they need to do, but I have seen over time birth control pill or contraception of any sort can really muck up, in plain language, muck up hormonal system. So her periods were like, she never knew when they were going to come, you know, 40 days, 25 days, sometimes light, sometimes heavy, lots of pain. So there was a lot going on for her. And those are kind of the main symptoms. And so we started, because of the birth control pill, because of the sleeplessness, because of the irregular menses and the fatigue, we started with the homeopathic medicine sepia. And homeopathic medicines come in different potencies. I chose a sepia 200C to start her off with. We worked with this potency and sepia for till her next menses so that I could evaluate. So that's about 5 weeks. And her next menses, it came, I'm not going to say on time, eventually it did. But what was really brilliant was that the period just showed up. There was no big PMS, there was no big pain. the flow was normal. It's normal to have heavy flow in the beginning, and then it tapers off. Um, Also changes were her sleep. So she would wake about 4 or 5 times a night. She could eventually fall back asleep. She started to wake only 2 times a night. So she gets better sleep. She's not as tired. And so we continued with CPF for, I'm going to say about 3 months, roughly, where we then were able to bring things back into balance. And she, could do what she needed to do for herself and her family. It was wonderful.
Beautiful. Thank you so much for that story. It's very telling, and I think it will spark curiosity in many of our listeners to maybe seek out help from a homeopath. And, Lisa, you mentioned this a great metaphor of pouring more fuel into the fire with the diet that we have, with all the toxins. And so apart from homeopathic remedies, what would you guide our viewers to consider when it comes to lifestyle, especially, diet, reducing toxins, activity?
Yes. Before I get to that, there was one thing I wanted to mention that I think would be helpful,
Yes,
Monica.
of course.
I don't know why many women think that menopause is kind of like an event, it happens and it's over. And I'm here to say that's not quite the case, but menopause is a natural occurrence. Think about puberty, right? It took years for women to go through puberty, and now it takes some time to go through menopause. And so it's not a disease of deficiency. It's not like, oh my gosh, now you don't have estrogen. Oh, it's a failure of your ovaries to produce estrogen. Not true. When the ovaries slow down, the adrenal gland jumps in, the pineal gland jumps in, the skin, the hair, the muscles, the brain, the body fat all start to produce hormones. They all start to produce something called DHEA. Don't ask me to say the big word of what it is, and testosterone, which are precursors to estrogen. So we have the ability to create the hormones that we need in the third chapter of our lives. But we do have to pay attention to what we eat, to how we live. Homeopathy can only go so far. So let's say I have a patient, for example, that suffers from hot flashes, but she's still eating processed sugar, right? Well, I have to have a conversation saying, there's only so much that homeopathy can do if we don't look at the four corners of the room. Okay, one corner we can't help, that's our genetic makeup, but the other three corners, if we don't attend to those, then there's only so much homeopathy can do. Now, I also want to mention, because you asked about nutritionally, if there is a concern for osteoporosis, then definitely calcium magnesium in a 2-to-1 ratio, vitamin D, and weight bearing exercises are crucial.
Okay, beautiful. Can you give us more examples of, proper diet and proper lifestyle that you see your patients would benefit from?
Let's talk about the liver. The liver, its job is to detox what we don't need in the body. So it will actually eliminate extra hormones, whether it's estrogen, progesterone, whatever we don't need. The liver's job is to get it out of the system, okay, along with other toxins in our environment, alcohol, all of those things. And so just imagine the liver these days, it's got a big job and we need to help it. So definitely having all the things that I mentioned before, reducing all the white foods, but really bumping up on all our fiber, because fiber actually helps pull out extra hormones, cholesterol, things that we don't need in the body. So whether you get the fiber through fruits and vegetables or whole grains or a combination, and when I say whole grains, I mean, for example, steel cut oats is, I'm not talking about processed grains, whole grains, and to vary the grains, right? So one day oats, one day quinoa, one day millet, spelt, so that you vary the grains, making it easier on the digestive system and the liver to do the job. And of course, always water, water, lots of water.
Yes, fresh water, filtered and healthy water. Beautiful. Yes, I mean, I really got a message from you that menopause is a process, and it doesn't necessarily has to be seen as something that is against us, that is a negative occurrence in our lives, because it's just a part of the natural life cycle, and it can bring us to a new stage of life that is naturally. I think that's how it's been designed to do. And so that was a message I got. And also, how much we can influence it. It's not easy because we live in a pretty toxic and difficult and challenging environment, let's be honest. But there is a lot of things we can do through our lifestyle and diet, and of course reaching to a homeopath, which is a wonderful way to encourage your body's natural processes, natural resistance, and natural health, drive, so to say. So
Yes.
I'm grateful for kind of giving that bigger picture today. And Lisa, is there something that you would like to leave our audience with, a message or something important that you would like to add to all that we already discussed?
One of the things I think that you and I touched on, Monica, earlier was, if someone is seeking to see a homeopath, where do you start? Uh, and, you know, I think that, and again, it depends where people live. Like here in Canada, in Ontario, homeopathy is regulated. So we have the College of Homeopaths of Ontario that people could go to and find a registered homeopath. In the States, there's the Council for Homeopathic Certification, CHC, that people can go to. I think it's important that when searching for a homeopath that will connect with you, that you do make sure that you do your research, that they have had the proper amount of education. In my network right now, I'm hearing stories of people studying homeopathy for 3 months and then calling themselves a homeopath. And I don't want to hear those stories. So, make sure you do some research. And the other thing, and this is just my personal idea, is I think it's important to have a chance, have the opportunity to talk to the potential homeopath prior to making an appointment,
Mhm.
because homeopathy is, you're in this with another person. It's a therapeutic healing system. And if you have a connection with that homeopath, that makes all the difference. And how do you know you're going to have a connection if you don't have the opportunity to have a quick chat with them to see if you have that good feeling, that good vibe when you're speaking to that potential homeopath?
Yes, beautiful. Absolutely. This is very, very important. Of course, we always encourage you to reach out to a homeopath, but please be mindful of, you want to find somebody who really is highly educated and who is really, has that connection with you. So do your research. There's many, many options out there available. So thank you so much for that reminder. That was very important. Well, this was a wonderful conversation. I really appreciate everything that you brought in today, Lisa. And I want to thank everybody and thank you so much for your time today. And we will be continuing with our series. And of course, reach out to me, and you can. I'm also going to provide Lisa's website, and you're, I believe, welcome to reach out to her as well if you have any questions regarding homeopathy and women's health. So thank you everybody for joining us today. And thank you so much, Lisa, for your time, for your energy and all the expertise that you shared. I really deeply appreciate it.
My pleasure, Monica.
All right. Thank you, everybody. Bye-bye.
Bye-bye.
Okay. Let's see. Yes, it's ending. Just taking a minute. Wonderful.